Can I still be bruised, swollen from lower eyelid fat grafting surgery after 3.5 months? I had lower eyelid surgery and fat grafting a little almost 4 months ago. From the looks of my photos, can you tell me if I am still swollen, bruised a little, especially on the left where he did more work? Is this normal in some patients to be still healing? I still see some puffiness and a dark semicircle spot still at the area I had the most bruising. I'm hoping I'm just a slow healer, but would like some opinions.
Thank you for your question. You submitted several photos and you describe in your questions that you're about 4 months out from having lower eyelid surgery and fat grafting. And you're questioning whether or not you still have some bruising and some swelling, and particularly with attention being drawn to the left eye. Well, with the photos you submitted and of course the absence of a physical exam, there's some degree of challenge to actually give you as much accuracy as is potentially possible. But I can share with you my analysis based on just the photos alone and your history. And to give you a little bit about my background, I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial and plastic and reconstructive surgeon practicing in Manhattan and Long Island for over 20 years. Cosmetic and complex reconstructive eyelid surgery is my specialty and is certainly issues related to similar procedures as what you've had done is things that I've dealt with or cases which I've dealt with in my 20-year career. So before going on with the specifics of what I think is happening, let's start with just what I see when I look at your photos. You said that you had lower eyelid surgery. Now, it is my belief that you most likely were attempting to improve puffy under eye bags. When I look at these photos, it appears to me that you still have puffy under eye bags. And what I suspect was a strategy by your doctor was that instead of removing or reducing the puffy under eye bags, which are represented by something called lower eyelid fat prolapse or herniated fat, the goal was to try to transition the cheek area by augmenting it or augmenting at least from the bulge of the fat to underneath in the eyelid to cheek junction with fat grafting. Now, fat grafting has been around for a long time, and certainly prior to the popular acceptance and introduction, I should say, of hyaluronic acid fillers, we were always challenged with how to augment the face in areas where there's volume loss. You know, understanding that facial aging is not just descent or genetic accentuation of issues such as fat prolapse, but also volume loss. So fat grafting has so much of the appeal because of its ideal natural source, the fact that it's coming from your own body, and it, when placed, once it heals, it stays for the duration, for the long term. But the problem has always been the same: predictability and variability of healing, as well as prolonged swelling. You know, without naming names, one of our most respected colleagues who has been advocating fat grafting for many years has had, unfortunately, a lot of difficulty with people's who is treated their results because of the unpredictability. And this is somebody who is considered a real authority in this area. And understandably, the problem is that the fat is not pure fat, and nor is the ability to take in the area that is placed consistent. We always say that if we're going to consider fat grafting, I always tell my patients there's a 30 to 70% absorption rate of fat, which means it can look too big and then not be enough, and two, it will most likely need a second procedure. Now that's my experience. I won't necessarily in any way want to conflict with other colleagues, but from my perspective and many of my colleagues who do feel the same. The situation you're dealing with probably is the natural healing process of fat grafting. You know, when I look at your left eye, I notice that below the puffy bag, there's a little lump there. And my suspicion is that there's an area of fatty tissue. You understand that fat grafting isn't pure fat. It's taken out with liposuction, and the material is a mixture of fat cells and supportive tissue, and as well as anesthetic fluid. And regardless of how it's spun and prepped, and you know, when we use fat, like I love using it for hands. I think it's fantastic, and in certain areas of face, it's good. But we will combine it with platelet-rich plasma. We'll use acellular matrix to try to improve its viability, and we get very good results. But I really discourage people from considering fat for treatment around the eyes. So most likely you're dealing with the natural healing process, and fat grafting healing can take a long time. There are patients who we've seen who, by referral, who either were scarred or had like lumps, hard lumps that had to be excised, or they were swollen and they were just dealing with chronic swelling that went on for years. In our practice, if someone like yourself comes in, I usually recommend lower eyelid blepharoplasty, typically a transconjunctival blepharoplasty. We do it from the inside. We reduce the fat pockets. We'll use laser and PRP to improve skin quality. And then to augment the cheek area to get some nice volume, we use a method called the Y-lift, or we can use a cheek implant, but we use the Y-lift method to add volume to the cheek to create balance to the face. In the modern world, people don't have time, and certainly the tolerance for unpredictability is basically zero. Our patients after cosmetic eyelid surgery, upper and lower lids, can come back a week later and have virtually no bruising, be back to work and be doing what they normally do, and not wrestling with this chronic swelling issue. So I think you need to, again, maintain communication with your doctor. Your doctor probably has a lot of experience doing this and will be able to guide you, and may need to put you on some anti-inflammatories or may need to inject some anti-inflammatories as well. But I still would point out to you that there is a lot of puffiness under your eyes, so you may need additional procedures to address that specifically. So the take-home message is that fat grafting can take extended period times to heal, swelling can last a long time, and that you may still need to address the puffy under eye bags with a more definitive and less traumatic approach that can allow you to heal a little bit faster. Again, it is 4 months after surgery, so there is still time to observe what's going on. In the meantime, maintain communication with your doctor, and if you're not comfortable, then find someone to get a second opinion with. So I hope that was helpful. I wish you the best of luck, and thank you for your question.